Hey everybody, my name is Manik Madaan, and in this video we're going to talk about USMLE versus NEET PG next. This is a question I get every single day, considering I've given both and I've gotten like a step 1 score of 260, step 2 CK score of 271, which is in the 99th percentile. I also have a NEET PG air of 4480 on my first attempt. Did not do any coaching for it, so what I just want to get into is, since I've given both the exams, I think I can make a really fair comparison between both. I ended up choosing USMLE over NEET PG because of certain reasons, and I will get into those reasons as we progress along this video. The first part that I want to differentiate between USMLE versus NEET PG and next is USMLE is not an exam. What I would say is it is a process. The reason I say USMLE is a process is because it is a 4-part exam. There's step 1, step 2 CK, step 3 and OET. Not only that, you have to go for electives where you have to work hard, you have to show your dedication to patient care, you have to get LORs, and then you have to also participate in the match where you have to make the ERAS CV and so much more. Like, there's so many things going on at the same time simultaneously. It's not like you're preparing for an exam, it's just like you're going through a process which is itself so long. Versus NEET PG, which is just one exam. For me, it was 3 hours long and it did not take a lot of time. And that's why I found it much easier. Step 1, step 2 CK. Step 1, I think, is like an 8-hour exam. Step 2 CK was a 9-hour exam. Step 3 is about, I think, 16 hours itself. Like, it's divided into 2 parts. The first one is more of 6 hours, like day 1. Day 2, which can be scheduled within 2 weeks of the first exam, is about 9 hours. OET itself takes 5 hours. So like, it's a very long exam, and the whole process can take somewhere between 1 to 2 years. So it takes a lot of time, 2 years on average. Now NEET doesn't take as much as time, so that's something to know. For next, what I would say is, next, since I have not given it, I can't really comment a lot in it. It's just 2 exams. This is next 1, next 2. Now next 1 is the theoretical part of the next exam, and next 2 is the practical part of the next exam. And what next is trying to do is, it's trying to kind of be like USMLE, where next 1 is more like USMLE, it is more clinically oriented, while like next 2 is more like step 2 CS, which was discontinued by the USMLE. And next 1 will decide your all India rank, and where you get your your rank, and what stream do you get to choose after that, which specialty do you get to choose after that. Next 2 doesn't really next 2 is just like, you need to pass it, and once you pass it, you can get into whatever college you want. It doesn't really decide. It's just a step 2 CS kind of like exam where they're going to see your clinical skills, and it's not really graded, so it does not decide where you end up getting your PG seat. So now that I've cleared this up, I'm just going to comment a bit on duration. To be fair, USMLE is at least a 2-year game. There are people who have done it in just 1 year, right after graduating their from their medical college. But most of the people, they take about 2 years on average. I took about 2 years on average to go throughout this while working in a place as a JR2. So it takes 2 years on average at least. People who don't end up matching can take even more years, because they end up doing something called as research electives, or they end up going for electives to improve their CV. And I know people who have taken 3 or 4 or 5 years to go and match into a certain residency. NEET PG doesn't take as much as time. It's like 1 year long. Next PG is gonna, like, most people take about 1 year to clear NEET PG. There are people who do it again right after getting out of college, but most people are gonna take 1 year to get prepare for the whole exam. With next, again, it's gonna be, we don't know like what's gonna be the scenario with this. Mostly, let's just see what happens with next. With difficulty comparisons, I would say that step 2 CK is the hardest exam in all of medicine, and right after that is step 1, right? And then like on the third number is NEET PG. The easiest exam out of all of this is USMLE step 3, which like it doesn't even require that much of preparation, and it's very easy to give. I found it the easiest out of all. Step 2 CK, again, the reason I'm saying it's so hard is because it builds upon step 1. So you need a really great basic preclinical knowledge, and then you need to integrate that with clinical knowledge, and it goes in so deep. a lot of the questions will, like a lot of the answer choices in the questions for step 2 CK are so nearby. It's very hard to sometimes like answer that question, and it is so very vague. And that's my take on step 2 CK. Step 1 again tests your depth of the knowledge, like how deep do you know a certain concept. And again, it's not a straightforward exam such as NEET PG, which is far more straightforward. With next PG, I'm not gonna comment. I feel next PG will be way harder than NEET PG, so it might lie on the level of step 1 or step 2 CK. Let's just see how that plays out. I can't really comment on next PG because we just have to see what happens with that. The other thing I want to talk about regarding difficulty levels is USMLE scores, once you get them, are permanent, right? Let's say you get your step 1 score, step 1 is going pass fail, you get your step 2 CK score. If you score low on that, that is permanent for about 7 years and you cannot change it. You can't do anything about it. Versus next or NEET PG, you can keep giving it over and over again and keep improving on your rank. So whatever you score is not permanent, right? And that's one of the best parts about NEET PG is it gives you second chances. USMLE does not give you second chances. Second, attempts count in USMLE. Let's say you failed step 1, programs will be able to see that. If you failed step 2 CK, programs will be able to see that. And if they see attempts, that's gonna decrease the chances of you matching there, because what programs want are people who can easily clear their board exams in PG, right? And if somebody has an attempt, that just kind of shows that maybe, I'm not saying like 100%, maybe this person is not like won't be able to clear boards and they don't want their board rates to like go down. So attempts do really count, but in again NEET PG next, attempts won't matter. Nobody cares about attempts. These next NEET and next PG, that's what I love about them, is they give you second chances, while USMLE might not give you a second chance, right? Fourth, depth versus breadth. So USMLE tests you on the depth of your knowledge, and it's not really that much of the width of your knowledge. For example, you don't need to know everything in medicine to really score high on step 1, step 2 CK. You need to know a few things, not a few things. You need to know like a certain number of things, but you need to know them so really well, because you're not gonna get like straightforward questions. They're like multi-level thinking, and they're more clinically oriented. For example, they're gonna give you a case scenario where a person has diarrhea, and that diarrhea came after they took antibiotics. So that means Clostridium difficile diarrhea. They won't tell you that. Now they're going to ask you, okay, we gave them a certain drug, and they won't tell you which drug is it. What is the mechanism of action of that drug? So there are 2 drugs that you give for Clostridium difficile like colitis. The first one is vancomycin. The second one is fidaxomicin. Vancomycin works by inhibiting the cell wall synthesis. Fidaxomicin really works as an RNA polymerase inhibitor. So that's what you will get. Like what is the mechanism of action of the drug? RNA polymerase inhibitor, cell wall synthesis inhibitor. It won't be like just a like single level. It will be multi-level thinking. NEET PG, on the other hand, what I found was very like it wasn't as clinically oriented. They weren't testing that. It was far more straightforward. For example, if a person has a certain condition, they'll tell you that. How do we treat that? So we had a question on aspergillus. Somebody had gotten invasive aspergillus, I think in NEET PG. I got that question, and the treatment was voriconazole, and it was really straightforward. So I found NEET PG far easier than USMLE in this prospect. But the thing that I would say with NEET PG is it does test you on the breadth of your knowledge, the width, like how much do you know. That's where it becomes difficult, because you need to know a lot of things that sometimes don't even matter, like dates and stuff, like dates when this was happened, like that doesn't even really matter and determine how good of a doctor you are. But you are tested on the breadth of your knowledge, which it can be difficult for a lot of people. And here's my take on it, and a very interesting thing. A lot of let's say AIMS Delhi and a lot of AIMS have a USMLE based curriculum where they teach them in a USMLE oriented style. These people also, like in AIMS Delhi especially, prepare in a USMLE manner. However, because of that, they end up scoring very well in NEET PG for some reason, right? Maybe it's because of critical thinking. With me, it was the same. I prepared for USMLE from the start. I also had a senior who did the same thing from the start. He prepared for USMLE. We did no coaching for NEET PG. PG. I did do a few videos from Marrow, from medicine, surgery, and OBGYN. However, did not do any grant test, nothing. I ended up scoring like 4,480 on my first try on NEET PG. So I guess like there's just something with USMLE and it trains your brain to think very critically. And once you're able to think very critically through a question, you can rule out options. And that is very helpful for NEET PG exams. And I think it does help. Preparing for NEET PG now with Marrow and Prep Ladder can also help with USMLE. However, I wouldn't say that you can score very high on USMLE with just NEET PG prep. You do have to go through the USMLE syllabus. Like you do have to find out, okay, how do USMLE questions work? Because they test you, like it just, superficial knowledge here does not matter. What truly matters is how well you know a certain topic. Like, and that's what I would say. If you've done USMLE prep, clearing NEET PG is not that hard. It's actually pretty easy. And another thing that I found was when I was giving my exam, like when I gave NEET PG 2022, my exam was about 3 hours long. And I ended up finishing it in 2.5 hours. So I had half an hour to go throughout the whole, like, you know, look at my, like, if I made any incorrect choices. So USMLE questions are so long, like the stems are so long that it will train you to speed read. It will train you to like think faster, like skim through questions. And that like helped me a lot in my NEET PG prep. So that's my take on it, my like what I think. So take it with a grain of salt. It's my opinion. With next PG, again, I feel it's more going to be USMLE based exam, like especially next one, where it's again gonna test you based on your clinical knowledge and multi-level thinking. So let's see like what it brings. And I think we'll shift from that breadth to the depth of knowledge testing with next PG. Holistic versus no holistic approach. USMLE is more of a holistic approach of testing a person. NEET PG and next PG are like not that holistic of an approach. The reason I say so is USMLE has two components of testing you. The first one is quantity. The second one is quality, right? Quantity is your scores. How well did you score on step 1, step 2, right? Maybe step 3. And that quality aspect is your CV, which what I mean by that is volunteer experience. Have you done anything for the society? Have you given out free content? Have you helped somebody? Have you participated in NGOs? Did you do something for the society? That matters. Second, your research experience. That matters. Have you done any research, like to show that you are really interested? Let's say in dermatology. If I'm interested in dermatology, I have to do research to show that I'm interested in that, right? That matters. Third, your professional experience. How much have you worked in a certain specialty? For example, if let's say I want to match into psychiatry, I have to do clinical rotations in psychiatry, at least in the US, to show that I'm interested at least in psychiatry, right? So that matters. Other things also matter, like personal statement. Then there's interviews where they see you, like, and you talk to them and they see how good you are in speaking English, how well are you trained to think through behavioral questions. Can you think like critically? So they have these certain questions where they see, like, talk about like what made you choose a certain specialty, and you have to convince, you have to tell them, like, you know, your own personal motivations. So they're really testing both the quantity and quality aspect of a person. However, with next and NEET PG, what I feel is it's more of a quantity based approach. This is my opinion, and like just again take it with a grain of salt, because the reason I say so is because if you get a rank, that will determine where you match or not match. So like your rank literally determines where you get, like in which hospital or institution do you get your PG seat. And that's it. There's no quality testing of a person. But next PG again will test people clinically, but again that does not determine a person's like place where they, you know, get their PG seat. So what I think again with NEET PG is and next is it's not a holistic approach, and with next PG we're trying to fix that. However, again, USMLE is far more holistic in like assessing a person. There are people who don't have the best scores, that is the best quantity, but they have really good CVs, and that gets them tons and tons of interviews, and they end up matching there. However, with NEET PG, if you don't have a good score, you can't get in. But with USMLE, if you don't have a good score, but you have really good qualities in you, you have really good personality, that might get you in, right? The next thing is money. So now USMLE is far more expensive. Right now I'm going through the process, and it costed me to about, like, you know, from step 1 till like the match, it costed me about $20,000 in total, give or take a few dollars. NEET PG, next PG, when I gave NEET PG, it was just like 5,000 rupees, which is about $75, right? Give or take. So NEET PG, that's a great thing. Next PG, it's far cheaper than USMLE. You don't need to invest in. Like when I talk about money, there's another part that needs to come in, and that is guarantee versus no guarantee. In USMLE, there is no guarantee. Like even if you have the best quantity, that is scores, or the best quality LOR interview research, you still might not match, maybe because you did not give your interviews properly, you did not follow up like with your interviews, right? There is again no guarantee. With NEET PG next PG, if you get a great rank, that is great quantity, you are guaranteed a seat in whichever specialty like you got a good rank for, right? In USMLE, you might, let's say like people spend up $20,000, right? $30,000. There is still no guarantee after spending that much money. With the NEET PG, at least you spend like how much? $75 per attempt, and there is a guarantee. So I'm not saying one exam is superior over another. It's just like they both have their pros and cons. So like again, think carefully when you're planning for either of these. The eighth thing that I want to talk about USMLE versus NEET PG and next is USMLE. Like if you go through the process and do residency, you will get a global license, and that global license, what I mean by that is American board certified. Once you become American board certified, you can practice in the US and all over the world for most countries. Like I wouldn't say all over the world, but a lot of other countries, 80 plus countries accept the USMLE degree that you get, the residency degree from the US. So you can go and you can come back to India and practice. You can go to Singapore, you can go to Australia, Dubai, Middle East, UK, and all of these places are very accommodating, and they will accept the license that you get from America because American board certified degrees, that is after residency, are very, very highly valued, and that can give you a chance to travel the world and practice like in a lot of places. The degree that you get after doing residency in India is only valid in India and a few other countries like the Middle East, but not a lot of countries. So it's in a way not a global license. So that's another aspect you need to think about. Ninth, residency duration. So that's very important. So the residency duration in India is about 3 years, like for every specialty that exists, from medicine to surgery to any other specialty, pediatrics. However, in the US, what happens is each residency has a different duration. For example, internal medicine is about 3 years. Psychiatry neurology is about 4 years. So like I am interested in doing psych, so that's going to take 4 years. Surgery, radiology, and plastic surgery, they are all 5 years. So they take a lot of time. So for like non-medicine specialties, let's say peds takes about 3 years. So for like these surgical specialties, it's going to take far longer to go through residency compared to India, so that's something again you need to think about. Now, residency tuition. In the US, there is no residency tuition, right? You don't need to pay anything to the institution, they will pay you. In India, there is a residency tuition, and you have to pay annually that certain tuition. For example, in government colleges, let's say center like Ames College, CIP Ranchi, and JIPMER, the fees is about 10,000 rupees annually. While in state colleges, it's about 1 to 2 lakhs, right, annually. In private colleges, non-deemed, it's about 9 to 16 lakhs, while in deemed colleges, it's about 20 to 70 lakhs, and management seats can go from 50 to 1 crore per year, which is a lot. So guys, thank you for watching. If you gained some value, please like and subscribe. It helps massively. And let me know in the comments what you want to watch next.